Hi everyone, and welcome back to the channel. If you're new here, I'm Dr. Razayan, specialist in arthritis and rheumatology. On this channel, we take a closer look at complex autoimmune diseases and help you make sense of them in everyday language. This video is for education and inspiration only. It's not medical advice. Always check in with your doctor and use trusted sources. Today we're tackling a rare and fascinating condition called mixed connective tissue disease, or MCTD. It's a systemic autoimmune disease, meaning it can affect the entire body. What makes it unique is that it features symptoms of several diseases, lupus, scleroderma, and myositis, all rolled into one. The standout lab marker? High levels of antibodies to U1RNP. That's why it's called mixed, a combination of symptoms and lab findings. Who gets it? Primarily young to middle-aged women, usually between ages 20 and 40. It's rare and can be hard to track because it often overlaps with other diseases over time. What causes it? Is autoimmune. The immune system attacks the body likely due to genetic predispositions like HLA-DR4 and DR2 and immune system dysfunction. This causes the body to produce autoantibodies like U1RNP, form immune complexes, trigger inflammation, and damage tissues. What does it look like in real life? Symptoms vary, but here are the most common. Fatigue, low-grade fevers, weight loss, and general malaise. Raynaud's phenomenon, fingers or toes turning white or blue in the cold, is often the first sign. Joint inflammation like rheumatoid arthritis. Muscle weakness in shoulders or hips. Skin rashes and tight fingers known as sclerodactyly. Other organs can be involved, like the digestive system with heartburn or swallowing issues. Lungs can develop interstitial lung disease or pulmonary hypertension, which is serious. The heart, kidneys, and nervous system may also be affected, but less commonly. How is it diagnosed? There's no single test. Doctors use criteria like the Alarcon-Segovia or Kasakawa guidelines. Diagnosis requires two things: high-titer anti-U1RNP antibodies, symptoms from at least 2 or 3 different connective tissue diseases. Lab tests often show a speckled ANA pattern, high U1RNP, elevated muscle enzymes like CK or aldolase, mild anemia, and inflammation. You may also see rheumatoid markers. Imaging may include CT scans for lung disease, echocardiograms or right heart catheterization for pulmonary hypertension, muscle MRI or EMG for myositis, or esophageal manometry for swallowing issues. Doctors also rule out similar conditions: lupus, systemic sclerosis, rheumatoid arthritis, and undifferentiated connective tissue disease. How do we treat it? There's no cure, but treatment is tailored to the patient. For mild symptoms like joint pain or rash, hydroxychloroquine is often used. For more serious inflammation, steroids help control it. Immunosuppressants like methotrexate, azathioprine, or mycophenolate are added based on organ involvement. Severe lung or heart disease may require cyclophosphamide or rituximab. Raynaud's is often managed with calcium channel blockers. Pulmonary hypertension may need medications like sildenafil or bosentan. What's the outlook? Most people have a relapsing remitting course. The prognosis is generally better than classic lupus or scleroderma, unless pulmonary hypertension is involved. Some patients may eventually develop lupus or scleroderma. Ongoing monitoring is crucial. You'll need regular tests for lung and heart function, blood counts, kidney function, and muscle enzymes. Watch for medication side effects. Track fatigue, strength, and quality of life, because managing MCTD is about more than lab results. Education and support are vital. Understand the chronic nature of MCTD. Stick to your medications. Watch for flares. Take care of your mental health. If you smoke, quit. Stay up to date with vaccines. Ask about referrals to specialists like pulmonologists, cardiologists, or physical therapists. Support groups and advocacy organizations can be a huge help. So to wrap up, MCTD is a complex autoimmune condition defined by U1RNP antibodies and features of multiple connective tissue diseases. It requires a personalized, team-based approach and close monitoring for the best outcomes. Thanks so much for watching. If you learned something, Give this video a thumbs up, subscribe, and share it with someone who might benefit. Take care, stay strong, and remember, your health is your power. See you next time.